welcome, dear viewers, to today's episode of Visite. I hope you all had a great last week and are starting another good one from tomorrow. And let's take some time again this evening for some interesting reader questions. I want to start with an inquiry from a young family today. Esther wrote to me. I take it from the email that Esther has 2 children. They live in the countryside in Switzerland, surrounded by a lot of nature. The children actually grow up with a great, great love. The children grow up in nature, and everything that Esther describes is already a good base for getting well and staying healthy. 2006, 2007, one of her daughters, Fabienne, got the first tetanus shot. And you did very well. You have given a tetanus-only shot without aluminium and without mercury. That was the only vaccination. And overall, the children of this family are exclusively treated homeopathically. But then in 2016, Fabienne came into contact with ticks. And then a circular rash developed on the forearm. We call this a so-called erythema migrans. In this, we can see even more clearly that there has been a transmission with spirochetes. And this borreliosis, which can possibly develop from such a contact, of course, was out of the worry immediately, treated with an antibiotic therapy, doxycycline. That's okay. This erythema then subsided, and the family has kept treating this borreliosis with homeopathic remedies every year. But now she writes the worries about Fabienne. Fabienne had a birthmark removed under her chin in 2020. It was just a very, very minor operation. And immediately afterwards, she had her first epileptic seizure. She described it like this. She opened her eyes wide for 5 to 10 seconds and was not approachable. And the face was devoid of colour. And that was a very frightening event. For the parents, or also for the mother, that was in March 2020. In November, the same thing happened. In an eyewear shop. And here the exposure to light may have been the trigger. Here too, she tensed up again, but she passed out. She was no longer responsive, and then slowly came to again. So, seizures without warning. It was thought to be a hypoglycemia at that moment. And now we are already in 2021. There was a third attack one morning, which of course worries the family as a whole. And she writes a sensory overload or a hypoglycemia early in the morning. Is that even possible? On the day itself, she went to school, but she was very tired that afternoon. The worry is now the distances are getting shorter and shorter, and what is actually behind it that could possibly have to do with her. In between, there were also dental treatments that did not burden her and have not triggered anything in her. It is important to know, does she have infections again and again? And she was able to answer this question in the email too. that she wrote that she always had severe herpes on her lip. Herpes viruses are herpes simplex viruses, and she takes vitamin C and zinc as a support. That's the email. And Mum, or Esther, is now asking me, what is the reason for these seizures? Can Borrelia still be the cause? And she's been taking Rissol Kappa from a pharmacy since December 2020. These are drops based on castor oil, enriched with walnut and various bitter additives, which have a very high, good antiparasitic effect. Esther, thank you very much for this detailed documentation and the course, and I would very, very much like to share my thoughts with you. First of all, you have to assume that your daughter grew up in a very sheltered, beautiful environment. I understand from how you write these lines, she was given a lot of love. And yet you have to say that whoever grows up in nature is also very close to nature. And the recurring strong herpes loads are an indication of an immune deficiency. This is the first approach, and really you should at this moment make an immune status to know more. Why she is prone to such very strong cold sore reactions, which, by the way, can be triggered differently. And very often it is also the sun, the UV light, that reactivates here, but you have to look at what is behind it. The other thing is, you are right. Lyme disease is, in my opinion, a very serious illness. And I wouldn't turn it into borreliosis and neuroborreliosis, but it is also a fact that the combination, for example, Lyme disease with toxoplasmosis, can accelerate this clinical picture. And in this case, you really should do a lymphocyte transformation test for Borrelia. To clarify this, and a lymphocyte transformation test for toxoplasmosis. One is bacteria, the other is unicellular. And there are hardly any medical indications of how we get to the question, are we talking here of an immunity dealing with these bacteria? Because toxoplasmosis is when you live in the countryside, and especially the children are in contact with animals. There are cats, rodents, dogs, there are horses, there are sheep. Then it is almost impossible that children do not grow up with these burdens. That means it will always depend on how far your own immunity is still able to cope with these loads. Because I've never experienced the development of borreliosis which did not have to bear many other burdens on the body or the immune system in the background. And herpes is an important concern for me here, which actually already shows that there is a certain weak point, which by reactivating these herpes viruses makes it clear to the body again and again that it needs support. That means I would definitely look into Lyme disease and toxoplasmosis here. It happened twice, and it happened from what was actually just perhaps sensory overload. You indicated in your email whether maybe the anaesthetic was the cause. I cannot confirm that now. Of course, you have to take that into consideration, but still she is now at an age where it would be very important to me. Are her wisdom teeth still there? Because the wisdom teeth correlate with the heart small intestine meridian. And if they are still impacted, you talked about dental examinations and surgical interventions. It may be that the wisdom teeth have now been eliminated, but wisdom teeth that are impacted or wisdom tooth scars after extraction can also provoke a clinical picture of epilepsy. So please have that checked. That means you need a panorama picture, an OPT. That will definitely be possible, but that has to be found by someone who could also understand these facts and the connections well. The wisdom teeth can, as I said, as well make completely different clinical pictures, but especially with epilepsy in young people, or epileptoid disease. I'd ask you to rule that out. The other is that we have to consider a parasitic load. And that is something that is very important to me. Taenia saginata is a beef or pork tapeworm. That means that we humans are not the intermediate host here. We can even be the final host. And these so-called proglottids, they are so small, parts that can be separated by 1 or 2 centimetres and are excreted with the stool. And that beef or pork tapeworm can establish itself in the human small intestine for many years. These small proglottids, which are no larger than 1 to 2 centimetres, that come off with the stool, each have in themselves 80,000 to 100,000 eggs. And they are deposited in grass, in hay, wherever. But the cow or the pig or whoever is there can become infected. And only there do these eggs grow into larvae. These are processes that can sometimes last for months. But, for example, we get these larvae, these so-called trichinae, through flies, through fruit that has not been washed. For example, through beef, which is not well cooked. Even calves, small calves are highly infected with these trichinae because this burden will actually be passed on during pregnancy to the next generation, passed on to the calf. So when the cow has these larvae and they develop within, then these actually get into the entire organism via the blood and via the lymphatic system, and they will mainly reside in the muscle meat. And of course, you can not only get it through meat, also through insects or beetles which ingest this excrement from the animals, but also through raw vegetables or salads, which can get infected with trichinae. And I just wouldn't want to rule that out. The disease that we humans actually feel, because with us it then also gets into the small intestine, and this beef or pork tapeworm, which also tends to establish itself firmly on the mucous membrane of the small intestine, This then ensures that we also develop different symptoms. And these symptoms, which then of course start with a certain performance insufficiency, this getting tired, listlessness, muscle pain, up to sensory disorders. And there is a disease that we call cysticercosis. So it is about influencing our brain activity. And here, the exophthalmos can get established, for example, that the eyes protrude slightly, but also psychosis, depression and epilepsy. And that's why I would want to rule this neurocysticercosis out, and I would consider it very important that you seek a diagnostic clarification in this regard. This is medically not easy, because you can, of course, detect the eggs in the stool. But for me, that's sometimes a bit like Russian roulette. Such a diagnosis is often off the table, only if we cannot specifically find anything in the stool. We have had the experience that when we do a bioresonance test, a salvia test, that is one form of bioresonance or electroacupuncture, to search for these things, Taenia as well as ascarids, roundworms, we are actually very conclusive. We get the proof incredibly often. Because we then resort to a parasite protocol, which is tailored exactly to this. And if it were confirmed, for example, it would have to be done with a certain amount of caution when we speak of a disease that takes on an epileptoid form. But still, there is no way around to treat these things in this way. The other things, apart from the pork and beef tapeworm, are actually, and this is quite a simple thought, but it is these children who live in the country, who are connected to nature, that they are highly contaminated with roundworms. These ascarids, we say today, 95% of our 4 to 7-year-olds have roundworms. And in the past, we have done deworming cures regularly and far more often. Every pet owner tells me, yep, sure, I deworm my dog twice a year. There are also pet owners who do not deworm because they are supposed to bring stool samples from the dog for 3 days in a row. And this stool is clean, so they don't deworm. That is not acceptable. So it is pre-programmed to be infected with roundworms. And that too can be diagnosed through bioresonance or electroacupuncture. The male roundworms are 15 to 20 centimetres long, and the females up to 50 centimetres. But what roundworms do, they send off up to 20,000 eggs a day. That means they can remain in the ground, sometimes for more than a month or 2 months. Depending on if the temperature is lower, this process takes much, much longer until the larvae hatch. But actually, they are taken in again through the fruit that has fallen down, through hands that are not properly washed, gardening, touching the dog, stroking fur, picking up a kitten. All of these are ways in which these things then get into the small intestine. They can also penetrate the wall of the small intestine, then go into the lymphatic system and into the blood, into the liver, get from the liver to the right part of the heart, then into the lungs, are swallowed again, and then establish themselves. So these roundworms have an incredibly large influence on a certain neurotoxicity, and that should not be underestimated. Back in 1912, when a doctor called Dr. Fleury investigated toxicologically, pharmacologically, and also chemically what are roundworms, how are they composed, what kind of high toxins do they form, and he said at the time that his writing, and this knowledge must be the basic knowledge of every doctor. Then they would never say so quickly again, that is psychological, it is psychosomatic, or maybe it's functional or chronic. And that is a knowledge that is a bit lost today. Sometimes the solution is so banally obvious that I wouldn't presume to say that's it. I just wanted to think about it. I just wanted to share my thoughts with you. What I, if she were my daughter, would urgently want to know. And Dr. Fleury has shown that roundworms consist to 50% of iron, bases, fats, carbohydrates, glycogen, but they produce, and he called this a scaryl alcohol. So this is an alcohol which can cause hallucinations in the central nervous system. Hysteria, epilepsy, tetanus, convulsions, delirium, and mental disorder up to meningism. And that is valuable information on my part that I would ask you to clarify with your daughter. Of course, you can also write an EEG and let the brain waves be recorded. And see how is the excitement recorded here at all. But with that, a therapeutic step is actually decided very quickly. And that's actually not the most important thing at the moment. The most important thing is that we understand why she is prone to those seizures, why I do not assess from this perspective as a hypoglycemia that simply the sugar level is now permanently decreasing. At this age, and anyway, the body protects us from such conditions because it can mobilise far too much sugar for its own metabolism. Usually this is only possible if you inject insulin. I hope I was able to help you a little for Fabienne here. It's a big issue that needs both caring and indulgence. And bit by bit, with every single step, I believe that Fabienne will regain a very beautiful and stable and happy health. We observe that, especially with such developing young people who also suffer from epilepsy, there are different forms of epilepsy, but actually all only experience one thing. They experience a drug setting to keep them seizure-free. But no one should make a therapeutic decision, which often takes weeks, months and years to complete, with all the consequences before they understand why this disease could develop individually in these people. We leave these paths very often because we are not able to do this medically. Today we are trained in a subject-specific manner. And with that, and I don't want to put any blame at all, but it only allows me to focus my gaze directly on the problem. And I wish from the bottom of my heart that we as doctors always show our greatness by being honest with our own limits and are committed to the last point in the interests of a patient. To find the cause. And it takes the networking of all of us colleagues with each other so that we end up with a very nice and good result of our treatment that everyone can be satisfied with. With this in mind, I wish you all a wonderful Sunday evening. And I hope you are looking forward to next week like me. And I'm very much looking forward to seeing you again next Sunday evening. Thank you very much.